Booster shots, they could start as soon as today. We got that word from the CDC director, Dr. Rochelle Walensky, officially signing off on a third dose of Pfizer's vaccine. Now, this affects millions of Americans, but you know, it was really a highly unusual move. She went a little further than the recommendation from the CDC's own panel of advisors on this. So, Dr. Nachman, talk us through the decision and, you know, that surprise move.
So I think, first of all, it's important to recognize that this is a truly independent panel. There's been a lot of talk about what the FDA says, ACIP, CDC, and I think it's important to recognize that these discussions happened out in the open. They disagreed with each other. They probed each other. Why are you saying this? What about this? Think about that. So I think that's important for the American public to recognize. This is a transparent process. Everyone has opinions, and they air their opinions. I think the ACIP panel, by saying, no, we don't think it should be for healthcare workers or first-line workers who are young and healthy, was looking at the big picture of those healthcare workers who have already received 2 doses. What is their risk? Are they mitigating risk by wearing a mask? Are they mitigating a risk by looking at who they're taking care of, doing all the right precautions? And how much more bang for the buck will the third dose be given? Remember, it's not the people that are lacking their third dose that are really responsible for the pandemic continuing to where we are now. It's all of the people who don't have their first dose. And I think that's what they were focusing on. That small percentage of needing their third dose versus the large percentage of pushing the pandemic who don't have their first dose. Is that bang for the buck worth it? I think Dr. Walensky, on the other hand, was arguing the contrary, saying even if the glass is half full, we have workers who have received their second dose, who may be at small but real potential risk of acquiring Delta and passing Delta, and we're not seeing any side effect or increased toxicity from the millions who have already received their third dose. Let's go ahead and give all of those first-line workers their third dose, because maybe that will add just a bit more protection and cut down on more Delta spread for those fragile populations, their patients. So I think it's the very fine line of how much more risk is there, minimal to none from what we've seen from those who have gotten already 3 doses, to how much benefit is there going to be for those first-line workers who may potentially be seeing Delta despite wearing a mask and getting infected. So I think that was her point.
Now, obviously, you know, she added all those other groups in there, but this is still a much smaller slice of the population than the Biden administration had planned, you know, last month to dispense, you know, booster shots to nearly everyone.
Right, and I think that it is, again, very important that those who need their booster dose get it. But I want to take a step back and say, amongst all the people that we're seeing hospitalized, not only here at Stony Brook, but across the country, who's getting hospitalized? 90+% of them are those who have never received a vaccine. So yes, getting their third dose will help a small percentage of the population. But when I think about how we're going to change the tide, it's really all about everybody getting their first dose. And that circles back to exactly what you started with this morning. We need all of the people to get their first dose. That includes teachers, healthcare workers, transit workers, so what you name it. Everyone needs to get their first dose, because we're really not going to turn the tide until we get those people also vaccinated and prevent them from getting hospitalized.